So this is a really important scenario. This has been coming a lot, and this is a bit different from the bleeding scenarios. Wait, before we start with the bleeding with this scenario, let's just quickly go through the table. This is a master table for the bleeding cases, like how we did for the shortness of breath cases. Here you can find all the bleeding scenarios. We have the postpartum hemorrhage case, we have the post-hysterectomy bleed, we have the hematemesis bleed, and then we have the back passage bleed. And the red highlighted portion indicates the differences in the management. In all the bleeding cases, you are going to activate the major hemorrhagic protocol. You will ask for 4 to 6 units of O-negative blood. You will ask for IV fluids 1 liter over 15 to 30 minutes, and you might have to give 2 liters of fluid in one up to 2 liters of fluid, and you will have to give tranexamic acid, but depending on the case, you will have to give some particular medications. For example, in PPH, you will be giving oxytocin or icometrin. In post-hysterectomy bleed, you will have to give IV fluids, and you'll have to send the patient back to the theater. So you'll have to talk to the surgical team as well. In hematemesis, you'll have to give PPI along with talking with the endoscopy team. And in the bleeding case, you will have to give the warfarin bleeding case, you will have to give vitamin K along with prothrombin complex concentrate. So these are the few differences that come in the management, and that's about it. Among all of these, this is the case hematemesis in which you can use nasal cannula to give oxygen to the patient if the saturation is low. Otherwise, that's the same. We have discussed everything in detail. So let's just start the next case now. If there's any question, please let me know in the chat box, please.